Hi everybody, welcome to the final component of continuous renal replacement therapy. This is part 6 and we'll be reviewing the Fresenius Multifiltrate and just looking at additional information that might be helpful to you. The learning objectives for this session are to review the sets, the hemofilters themselves. We're not looking at pediatric, this is all to do with adults. Some of the lines, transducers and sample sites, the priming solutions and fluids. We'll just mention briefly how the dialysate and substitute are warmed to prevent hypothermia and look at the battery backup with some of the selected screen modes that you'll see as we go through. By no means complete. This isn't to teach you about the multifiltrate. However, subscribe to me if you do. We can have that as an additional Learnshop. Now the multifiltrate itself, let's just review. At the monitor screen, 1 is the screen itself, 2 are the tube holders, 3 the rotary selector and OK key, 4 the escape key, 5 the mute key, 6 the stop key, 7 the start and restart key, 8 the on off key, 9 all the status indicators, green indicating normal operation, yellow is warning and red is an alarm. In addition to that, the extracorporeal circuit, which is the body of the machine. 1 is the dialysate heater, which is indicated by the green dot. This is where the dialysate solution is heated. 2, the dialysate pump, also indicated by a green dot. Then you've got 3, which is just a tube holder to keep everything neat and tidy. The substitute pump is indicated by the white dot, and the substitute heater is also indicated by the white dot. And this is to heat the substitute solutions, again to prevent hypothermia. 6, 7 and 8 are just tube holders to keep everything neat and orderly, in addition to 8 being a tube holder as well. 9 is the blood leak detector, and as we've indicated previously, we're talking about 0.5 of a mil. 10 is the venous tube clamp and optical detector. 11 the filtrate pump, filtrate indicated by yellow, urine. The warning label, it's just a protection against the effects of the defibrillating discharge, which means it helps prevent the machine from any electrical damage. 13 the filtrate pressure port, yellow again indicating filtrate or urine. 14 the air detector. 15 the blood pump indicated by the red dot. Pressure port before the filtrate is white, substitute solution. And arterial pressure port, again anything arterial, access red. Venous, anything venous is blue. The extracorporeal circuit. Then the adjuncts that we're going to be looking at are the multifiltrate kits, lines, transducers, hemofilters, fluids, accessories, and then sort of putting it all together, which we're really not, because again, this is not a workshop or a Learnshop that provides you with detailed information about the multifiltrate Fresenius machine. However, if you want one, please indicate to me, and this can be provided in future Learnshops in a little bit more detail. So let's just go briefly through step-by-step instructions. And this is not to give you step-by-step instructions, but just to show you how user-friendly this machine is. So with preparation, after everything's passed its functional test and it's safe to continue, it'll show you what to do, depending on the therapy that you want to use. I'm going to be going through all CVVH-DF, continuous venous hemodiafiltration, because from my perspective, it's better to set up the whole pump in the complete mode. And that way here, you don't have to use everything. You can just use scuff if you want to. You can just use CVVH. You can just use CVVHD, or you can use CVVHDF. If you don't prime it with CVVHDF, which means everything, then, for example, if you've set it up for scuff, slow continuous ultrafiltration, you're only using a very small component, the arterial and venous and filtrate. And if you want to extend it into hemodialysis, you can't. You're going to have to end therapy and reset the whole thing. So from my perspective, and this is only my perspective, it's better to set up the pump completely, as we're going to do now. Here, the arterial access, step-by-step instructions. Venous, step-by-step instructions. Filtrate, step-by-step instructions. Dialysate, step-by-step instructions. Substitute, step-by-step instructions. And then, if you're going to be using the heparin as anticoagulation, you can prepare that as well. And then you end up with a complete tubing arrangement. But this is for CVVHDF, not for something like scuff. You can still use scuff, you can still downturn to CVVH, you can then downturn to CVVHD, or you can upgrade to CVVHDF. By priming it in the complete tubing arrangement, you've got everything, just in case. Now the kits are user-friendly as well. Typically here, this is the arrangement as the cassette, and it comes with everything if you choose to use it. Here, it's very, very user-friendly. The machine will give you step-by-step instructions on how to install it. Very user-friendly. These are, for example, this is what you'd be using here if you were using scuff. Just an arterial line, a venous line, and a filtrate line. The arterial and filtrate you can see here. Machine will give you instructions on how to install it. The dialysate, if you're going to be using hemodialysis, is an additional component. The substitute, if you want to use CVVH, then that's an additional component. The transducers are all color-coded as well. Venous, substitute, arterial and filtrate lines. User-friendly. They're all connected. There is no blood interface, which means the lines don't make contact, or the transducer lines don't make contact with the blood, which is something that happens with other systems. They're connected, they're screwed in as per the instructions. And then you end up with an arterial transducer, which, remember, isn't really arterial blood, it's just terminology. The venous transducer, the substitute transducer, and the filtrate transducer. Then you've got the hemofilters, and you've got a number, and as I said, I'm not going through paediatric. If paediatric is something that you want in the future, then subscribe to me and inform me that that is something that you would want. But this is the AV400S, which allows you to have 50 to 200 mils per minute as far as the blood flow rate. The filter surface area is the smallest of the adult ranges at 0.7 meters squared. The recommended period of use is for 72 hours or 3 days, because then the filter may be compromised. Then you've got the AV600S, 100 to 350 mils per minute. The surface area for the filter is a little bit bigger at 1.4 meters squared, and the recommended blood flow rate is from about 100 to 350 mils per minute. 3 days is the recommended maximum time of use. Then you've got the largest of them all is the AV1000S with a blood flow rate of 200 to 500 mils per minute and a surface area of the filter at 1.8 meters squared. The priming solutions are typically Fresenius, but typically it's 1 to 2 litres of normal sterile saline, with or without anticoagulation. But you follow your hospital guidelines always. When you prime the filter, this one's demonstrating the AV600S, it's primed with normal saline. The filter is inserted into the filter cartridge holder and it's inverted because it's priming from bottom to top, arterial to venous, as you'll see in a few moments, and you invert the filter to remove all the air. You connect the red arterial to the bottom of the filter, which has been inverted, and the blue venous to the top, because the priming solution goes via the red arterial port and the blue venous goes to the effluent bag. So blue goes to the top, arterial goes to the bottom. Then you've got the yellow filtrate, which is connected to the bottom side next to the arterial port on the side, because this will be collecting the fluid which has got air in it. So you connect the yellow filtrate to the bottom side near the arterial inflow connection, and then you use your priming spike to connect to the priming solution. Now, circuit priming, you need to connect the arterial axis to the priming fluid. As you can see, arterial access to the fluid, which is normal saline. Now it's connected, and this will take normal saline, take it to the bottom of the filter, push the air out into the blue port, which is connected to the filtrate bag. So you connect the venous axis to the filtrate collection bag, which is hanging on the IV pole. Clamps are opened. You can also insert the dialysate pump segment if you're going to do hemodialysis, or the total therapy, CVHDF. It goes into its own pump segment and it's connected to the dialysate fluid, which has been placed on the upper scale number 1. You connect the dialysate access to the top of the side port, because this is where the fluid goes in, and the fluid pushes the air out into the filtrate bag. So you connect the dialysate access to the dialysate fluid, which is on scale 1. You also, if you want to do CVVH or CVHDF, you insert the substitute pump segment and you prime it. You place the substitute fluid on the top scale, number 2, the second scale. You connect the substitute fluid to the substitute pump segment, then you've got to think about the syringe driver. And typically it's a 50ml syringe driver that's used. But again, you follow your hospital guidelines depending on what type of 50ml syringe that you're using. You follow the instructions. The instructions are very, very clear, very simple to follow. You've got your 50ml syringe, you put it into the syringe holder or driver, and you connect it to the system. Make sure all the connections are tight. If we review the syringe driver, 1 is the key that moves the slide cartridge up and down, or in this case 1 up. 2 moves it down by pressing the key. 3 is the syringe holder. 4 is the slide carriage. and 5 is the grip handle that holds the syringe. Prior to priming, it's important to ensure all the clamps are open. Make sure all the clamps to your dialysate solution and your substitute solution are open. Otherwise, you'll entrain air into the system. Make sure you break all the cones on the solution bags. They all have to be broken. Otherwise, fluid can't drain into the system. And that will entrain air. And certainly your machine will alarm. Then make sure all the connections throughout the whole circuit are tight prior to priming. Prior to priming, it's asking you, this is the complete tubing setup, and you confirm that you've done everything that the machine has asked you to do by pressing the OK key. Prior to starting priming again, be sure that all the clamps are open, that all the cones on the solution bags are broken, and the connections are tight. Unlike the Prismaflex system, you've got all individual pieces that you have to put together. It's not a complete set. You're responsible to make sure that everything is complete, clamps open, cone solutions are broken, and connections are tight. Now the priming volumes depend on which parts of the set that you want, according to what therapy you're going to use. SCUF, CVH, CVHD, CVHDF. So when it comes to priming, there are all individual volumes that must be considered. So for example, the AV set multifiltrate takes about 145 mils. The filtrate system itself, 23 mils. The dialysate, 158. The substitute, 159. If you're using CVH, then again you're using a slightly higher volume, 275 mils. The multifiltrate cassette itself, arterial and venous, takes approximately 166 mils for the arterial side and 143 mils for the venous side. If you're using pediatrics, which we're not discussing here today, the AV set takes a total of 181 mils. It takes a total of 81 mils. Hemofiltration fluids are ordered according to the hospital guidelines. But however, as an example, look at this. Hemofiltration fluid number 1. Typically, the format of the fluid with Fresenius is HF stands for hemodialysis fluid. The first numeric, HF0 in this case that we're looking at, said that there's no potassium. If you looked at, for example, HF11, there's 1 gram added. If you're looking at the second numeric, that's other electrolytes or buffers that could be added as well. So it depends on what your hospital has ordered in relation to what sort of fluid that you actually have to use. If there's a battery, and there is, and there's a power failure, you've got 15 minutes of emergency power use. This would be the screen that you would see, power failure, and it tells you emergency operation available for a maximum of 15 minutes. Just in case you're not aware or not as familiar or you've forgotten, it will remind you. At the end of the emergency operation, the unit will turn itself off automatically after 5 minutes. And this is all important so that you can return the patient's blood. So let's review. Choose the CRRT that pertains to the movement of solutes through a semi-permeable membrane from high to low. Is it hemoperfusion, SCUF, CVHD or CVH? The correct answer is continuous venous hemodialysis. The process is diffusion. Solutes that may be removed by CRRT include urea, creatinine and potassium, or all of the above. The correct answer is all of the above. Review activity number 3. A disadvantage of CRRT is that it may promote hypothermia, hypothermia, hypotension, or none of the above. The correct answer is hypothermia, which is why in this system you have a dialysate heater and you have a substitute fluid heater. CVHDF stands for A. Continuous venous-venous hemodifiltration, controlled venous-venous hemodialysis fluid, complete venous vessel hydrogen and drug filtering, or nothing at all. The correct answer is A. Continuous venous hemodiafiltration. Question 5. The multifiltrate CRRT components include which of the following? A hemofilter, 4 pump roller segments, colour-coded lines and pressure transducers, or all of the above? The correct answer is all of the above. Hemodiafiltration is another way of saying CVHDF. Utilises both hemodialysis and hemofiltration therapies. Removes solutes by convection and diffusion, or is it all of the above? The correct answer is all of the above. Types of anticoagulation that may be employed during hemofiltration with the multifiltrate unit is citrate, heparin, prostacyclins, or all of the above. The correct answer is all of the above. Although you do have a citrate calcium pump, and heparin can be used as an alternative. Choose the correct multifiltrate CRT status indicator combination. Alarm means red. Warning is yellow. Operating normally is green. Is it all of the above? Are they all valid? The correct answer is yes, they are. They're all correct. 9. A red alarm will alert for which of the following problems? Air detected, filter clotted, blood leak detected, or all of them? The correct answer is all of them. Name the following multifiltrate components. 1, 2, 3, 4, 5, and 6. The correct answer is 1 is the IV pole, 2 is the first dialysate scale, 3 is the second substitute scale, 4 is the monitoring screen, 5 is the body of the pump, the extracorporeal circuit module, and 6 are the scales, 3 and 4, to weigh the effluent. So, in summary, multifiltrate CRT is a strategy, as we've indicated throughout the whole of this Learnshop, for acute kidney injury in critically ill patients, as it removes not only waste products but other molecules such as cytokines, which are targeted for removal, especially in septic patients. This Learnshop Part 6 added important features of the multifiltrate unit, the set, adjuncts, but look, it's by no means complete for practical competency. For practical competency, you actually have to do hands-on. However, as I've indicated, if you want an additional Learnshop that's a little bit more structured as far as the practical components, please let me know. I would be very happy to create that. Take care, and thanks. Now, look at some of the other Learnshops, and if you found this of any value, please recommend it to your colleagues, subscribe, it's important to continue all these Learnshops. See you in other Learnshops. Bye.